Welcome back to the deep dive. Today we're taking a plunge into something that sounds, well, maybe incredibly specific at first glance. But trust me, it's got layers. We're talking rectal tears in cattle.
Exactly. And, when you first hear that term, rectal tear, you might just picture a simple localized injury. But the sources we've looked at show it's actually a critical veterinary emergency. It ties into everything, really, animal welfare, pharmaconomics. It gives you a lens into the bigger picture of livestock health.
Right. So our mission for this deep dive is to sort of distill the vital stuff for the detailed veterinary research and clinical guides you've provided. We're going to unpack the causes, the serious implications, how vets classify them, diagnosis, treatment, and really importantly, prevention. The goal is to give you a quick but still pretty thorough understanding and maybe reveal some surprising connections. Okay, so let's kick things off. What exactly are we talking about with a rectal tear?
Well, basically, it's an injury to the wall of the rectum. Simple as that sounds. But the key thing is the range. It can be anything from just a tiny scratch on the inside lining that's the mucosa, all the way to a full thickness rupture where the entire wall is breached.
And that range, that spectrum of severity, sounds critical.
Oh, absolutely critical.
Yeah.
Because if you get one of those deeper, full thickness tears and it's not caught and managed like right away, it can lead to really devastating things. Peritonitis, that's a massive infection inside the abdomen.
Yeah, nasty stuff.
Or even sepsis, where the whole body reacts with inflammation, and ultimately it can be fatal. And what's fascinating, or maybe worrying, is how far the impact spreads beyond just that one animal. It's not just a physical injury. The animal welfare implications are huge, and the economic hit for the farm, significant. Well, think about reproductive performance going down, higher culling rates, less milk if it's a dairy cow. And our sources even mention potential malpractice suits for vets. It's serious. The financial burden is often way underestimated. It's not just the vet bill, it's all these knock-on effects.
Wow. Okay, so here's something that really jumped out at me from the anatomical side. You'd think a tear could happen anywhere along the rectum, right? But the research points to a specific weak spot.
Yeah, that's right. Most of these tears in cattle happen dorsally so, kind of on the top side, about 25 to 30 centimeters up from the anus. And there's a reason. If you picture the rectal wall in that specific area, the circular muscle layer is naturally a bit thinner. But nearby, there's this band of tissue, the mesenteric taenial band, which is thicker. It sort of creates a stress point.
So it's not random. It's like a built-in vulnerability.
Exactly. It's an anatomical predisposition.
Okay, so how do these injuries actually happen? What are the main causes?
Well, the most common cause, and maybe the one that's most surprising or difficult to talk about, is iatrogenic injury.
Iatrogenic?
Yeah.
Meaning caused by a medical procedure.
Precisely. The vast majority of these tears happen because of improper or maybe too forceful rectal palpation, during routine things like checking for pregnancy or other reproductive exams.
Right. And are there things that make that more likely?
Definitely. Several factors increase the risk. Things like poor restraint, the animal moving suddenly, not using enough lubrication, or the person doing the palpation just using too much force, or maybe not having the right technique.
Okay.
And certain animals are just higher risk to begin with. Heifers, for example, or smaller framed cattle. Older cows, too. Sometimes their tissues aren't as elastic. And it's not just hands. Other tools like ultrasound probes or semen evaluation probes, if they're used roughly, can cause tears too.
So human factors, procedural issues, that's a big piece. But you mentioned non-iatrogenic causes too, the ones not related to exams. What are those?
Yeah, and this is where you really see the connection to the animal's overall health. So beyond exams, you can get tears from physical trauma. Like, say, the cow swallowed something sharp, a bit of bone, a needle maybe that punctures the wall from the inside. Or external trauma, a bite wound maybe, or a fall. But a really major, often overlooked factor is excessive straining. The technical term is tenesmus.
Straining.
Yeah.
Like pushing too hard. What makes them do that?
It can be a symptom of a whole bunch of underlying problems. Gastrointestinal issues are a big one. Severe or chronic diarrhea, maybe from coccidiosis, which is parasitic, or colitis, inflammation. Or even things like blockages, intestinal impactions, hemorrhagic bowel syndrome, too.
Yeah.
Then you've got urogenital problems, dystocia, that's difficult calving.
Right.
If the calf's nose pushes up into the rectum during birth, that can cause damage.
No.
Vaginal or uterine prolapse can lead to straining. Bladder stones, urolithiasis, or bladder infections, cystitis that cause pain and straining too.
Wow.
And even behavior. Excessive riding among young bulls can cause trauma.
So it's this huge web of potential causes.
It really is. And systemic factors play a role too. Nerve conditions, neuropathies, dietary imbalances like too much concentrate feed, not enough fiber, dehydration. Obesity can contribute. Hormonal issues like too much estrogen or cortisol.
It sounds like anything that puts stress on the animal, physically or internally.
Exactly. Even things linked to management, high-energy diets, and feedlots can lead to aggression, social stress, and surprisingly, conditions like magnesium deficiency or even BSE, mad cow disease, can cause violent behavior that leads to injury. So yeah, if we connect this to the bigger picture, a rectal tear can be a really critical sign of deeper health issues going on. It highlights why whole herd health management is so crucial, not just treating isolated incidents.
Okay, that makes sense. Given all those different ways a tear can happen, how do vets figure out how bad it is once it has occurred? This is where that classification system comes in, right? The grades.
Precisely. And this four-grade system is absolutely vital because it directly impacts the prognosis, the animal's chance of survival, and dictates the treatment approach. What's absolutely critical here is the depth of the tear.
Okay, break it down for us. Grade 1.
Grade 1 is the mildest. It only involves the mucosa, that very inner lining. The prognosis is generally very good. Survival rates are like 93 to 100%.
Okay, grade 2.
Grade 2 goes a bit deeper through the mucosa and the layer underneath, the submucosa. And this is key, the main muscular layer is still intact. These are often found by chance, maybe during a later exam, and they also have a good prognosis. Though sometimes they can lead to a pouch forming called a diverticulum or even a hernia later on.
Okay, getting more serious now. Grade 3.
Yeah, grade 3 is where things get really serious and time is critical. There are two subtypes, 3, 3, and 3. Grade 3 means the tear goes through almost all the layers, stopping just short of the very outer slippery layer, the serosa. But grade 3 means it has breached the serosa and extends into the surrounding fatty tissue, the mesentery, or the space behind the abdomen, the retroperitoneal space.
And the danger there is?
Fecal contamination. Getting manure into those normally sterile areas, both R and 3 need immediate aggressive surgery to prevent that.
And grade 4.
Grade 3 is the worst case scenario. It's a full thickness tear that creates a direct opening into the peritoneal cavity, the main abdominal space. This means widespread fecal contamination and severe peritonitis. The prognosis here is grave. Survival rates plummet to around 2%.
Wow, only 2%?
Yeah, and this really underscores why getting a rapid, accurate diagnosis is paramount. It tells the vet how urgently they need to act, how invasive the treatment needs to be, and what the real risks are. Every minute counts, especially with grades 3 and 4.
So how do you spot these tears? What are the telltale signs, especially if you can't see it directly?
Well, the biggest red flag is often that tenesmus. We talked about the excessive straining. You might also see hemorrhage, fresh blood on the vet's glove, or sleeve after palpation, or blood in the manure, and then just clear signs of pain. The animal might stand with an archer back, walk stiffly, maybe grind its teeth.
And if it's a more severe tear or infection starts setting in?
Then you start seeing systemic signs. The heart rate jumps up tachycardia, maybe 90 to 140 beats per minute. Mucous membranes might look pale. The animal could be weak, dehydrated. You might see acute rumen stasis, where the rumen just stops working properly. And sometimes, Melina, that dark, tarry stool from digested blood, usually indicating bleeding higher up, like the abomasum, though that takes about 8 hours to show up.
So the physical exam seems absolutely key for diagnosis. What does that involve?
It really is the cornerstone. Often, the first clue for the vet is feeling that sudden loss of resistance during the palpation itself. Like, oops, something gave way. The next step is to very carefully, very gently, try to assess the extent of the tear, how big it is, where exactly it's located. Sometimes, to get a better feel, they might even use a bare arm or cut the fingers off a standard rectal sleeve and wear the thin latex glove underneath for more sensation.
Are there other diagnostic tools they might use?
Yeah, beyond the hands-on exam, there are ancillary diagnostics. Abdominocentesis is important.
That's drawing fluid from the belly.
Exactly. You draw a fluid sample from the abdomen to check for infection, for peritonitis. Especially crucial for suspected grade 4 tears, you might even see obvious fecal matter in the fluid. Ultrasonography can be used too, looking for abnormal fluid or gas pockets in the abdomen. And sometimes, carefully using a vaginal speculum might help visualize a tear, depending on where it is. It's also important to rule out other things that could cause similar signs, like a rectal prolapse, intestinal blockages, stomach ulcers, other causes of peritonitis, or infectious gut diseases.
Okay, so once you've diagnosed it and you know the grade, what about treatment?
First things first, especially with those higher grade tiers, is immediate emergency stabilization. You have to reduce the risk of peritonitis and shock.
How do you do that?
It starts with controlling the pain and the straining. A caudal epidural anesthetic using something like lidocaine or maybe xylazine is pretty standard. It numbs the back end, relaxes the rectal wall, which helps with examination and potential repair. Sedatives or muscle relaxants might also be given. Then there's systemic support. Intravenous fluids are crucial things like crystalloids or maybe hypertonic saline to combat dehydration and shock. Broad-spectrum antimicrobials, antibiotics are essential to fight off infection, especially with penetrating tears. And NSAIDs, non-steroidal anti-inflammatory drugs like Flunix and Meglumine to manage pain and inflammation. It's a multi-pronged approach right from the start.
So the immediate care is vital. How does the treatment path differ based on the grade of the tear?
Right. The grade really dictates the long-term strategy. For those milder grade 32 tiers, conservative management often works well.
Meaning no surgery.
Usually, yeah. It involves things like modifying the diet, maybe adding fiber, using laxatives like mineral oil just to keep the stool soft and reduce straining, plus those systemic antibiotics and NSAIDs we mentioned to prevent infection and keep the animal comfortable.
Okay. But for grades 3 and 4?
That's where surgery becomes pretty much mandatory, and it needs to happen fast. There are different surgical techniques. Sometimes the tear can be sutured directly, either kind of blindly by feel or using specialized instruments. Surgical staplers or barbed sutures might also be options.
And for grade 4, where the outlook is so poor?
For grade 4, because of the high risk of fatal peritonitis, sometimes more drastic measures are needed if you're attempting treatment at all. Things like temporary rectal liners or procedures called loop colostomy or end colostomy, basically creating a temporary opening to divert feces away from the rectum, allowing it to heal.
Like a stoma in humans?
Yeah. Sort of, yeah, a temporary bypass. In really severe cases, maybe with tissue death or prolapse, rectal amputation is technically possible. But honestly, for many grade 4 tiers, given the extremely poor prognosis and welfare concerns, euthanasia is often the most humane recommendation if effective surgical correction isn't feasible.
That's tough. And assuming surgery is successful, what happens next? Post-op care.
Oh, absolutely crucial. It doesn't end with the surgery. You need continued medications, antibiotics, pain relief. Strict dietary management is key to keep the feces soft for weeks. And really vigilant monitoring for any complications, watching for signs of peritonitis developing, abscesses forming, or strictures, which is where the rectum narrows due to scarring. Or even the tear recurring. It's intensive follow-up.
Okay, so we've covered what they are, the causes, grades, diagnosis, treatment. It's complex. Which really brings us to the most important part, maybe, prevention. How do we stop these cures from happening in the first place?
Absolutely. Prevention is definitely multifaceted, but it's key for both animal welfare and the farm's bottom line. Given how common iatrogenic injury is, focusing on best practices during rectal palpation is number one.
So better technique.
Yes. Proper technique is crucial. Being slow, deliberate, smooth, not forcing against peristalsis, the natural gut waves, or when the animal strains. Using plenty, and I mean plenty, of lubrication, that minimizes friction. Proper restraint is also vital, and sometimes using sedation, xylazine, maybe butorphanol, or even an epidural can make a huge difference, especially with nervous or jumpy animals. It just relaxes everything.
Yeah.
And of course, being aware of those high-risk animals. We talked about the heifers, the smaller ones, the older ones.
So it's about the vet's actions, but also managing the animal's overall situation too, right? Those predisposing factors.
Exactly. Prevention goes way beyond just the palpation itself. It means tackling those underlying issues. Controlling diarrhea in calves through good colostrum management, hygiene, nutrition. Preventing difficult births, dystocia, through smart sire selection. Keeping cows in good body condition. Intervening in calving problems promptly but carefully.
Nutrition seems important too.
Hugely. Avoiding those high-concentrate, low-fiber diets that can cause acidosis or impactions, making sure they always have enough water. Managing behavior, providing enough feeding space to reduce aggression, using low-stress handling, castrating bulls early, and managing rectal prolapse if it occurs. It really paints a picture, doesn't it? How many different threads connect to this one potential problem? A good stock person or vet is juggling a lot of factors.
Definitely sounds like it. What about broader herd health stuff? Biosecurity?
Yeah, those play a role too. Things like maintaining a closed herd help prevent bringing in infectious diseases that might cause diarrhea or other issues leading to straining. Keeping birthing areas clean is important for preventing calfhood diseases. Basic equipment hygiene, too. And honestly, a huge part of prevention comes down to education, educating clients, farm staff, handlers.
About the risks.
Yes, making them aware of the risks, teaching them to recognize the early signs that straining, maybe signs of abdominal pain, and stressing the importance of communicating with their vet about any concerns. That proactive, informed approach is just essential.
Well, you came for a deep dive into rectal tears,
Mhm.
and I think it's safe to say we went deep. I hope you leave, as I do, with a real appreciation for just how much goes into preventing and managing what seems like a specific injury, but is actually, well, really impactful.
Yeah, I think this deep dive really shows how one problem, like a rectal tear, isn't isolated at all. It's intricately linked to, animal behavior, nutrition, disease control, management practices, even economics. And understanding these connections isn't just for vets. It's valuable for anyone interested in sustainable, humane livestock farming.
So it leaves you wondering, doesn't it? What other seemingly niche issues in animal health might actually hold surprising clues about much broader challenges? Biological, systemic, even economic. Keep exploring, keep questioning.